Start. Again, welcome to Rutgers Global Health Institute membership meeting for 2024. I wanted to just show the agenda, the roadmap of where we're going to go with the meeting. These 6 points, I won't read them. You can read them as well as I can. But this will be our landmarks throughout the meeting. I get to introduce Chancellor Strom, our leader in this endeavor. And I really, the reason I say that is Brian Strom's really spearheaded the creation of one of the best academic medical centers in the country. Since he came, that was his goal, and also with an emphasis on one, as you'll hear him say. And he's guiding all of us and all the many parts to move towards one in that vision. And Rutgers Global Health Institute is an example of his vision, in that for one global health effort across all the units of Rutgers to promote and help unify the mission of health equity across Rutgers. Now, this is academia. We're not telling people what to do, but we have a platform through Brian's vision to at least have an institute that goes across all of Rutgers to promote and help unify. So may I call on you, Brian, pass the baton for your welcoming remarks.
Yeah, of course, Rick. Thank you all, and thank you for joining. I'm delighted to see so many people showing up for it as well. It's a privilege to welcome you to this year's annual membership meeting for the Rutgers Global Health Institute. When I first arrived at Rutgers now about 11 years ago, I made it clear that our shared vision is to build not just a top-tier academic health center, but one that stands as a beacon for others, with the goal of becoming one of the leading institutions in the country. Crucial part of that vision, as Rick alluded to, is grounded in the concept of one unified force working to better the health of all people, not just by treating illness, but by fostering wellness and preventing disease across all populations. That's where the Rutgers Global Health Institute plays an essential role. When we developed the idea for the Institute as part of our first strategic plan, our primary objective was to harness the broad interdisciplinary expertise at Rutgers to tackle health inequities worldwide. The work you're doing embodies that mission by advancing global health, promoting health access, and driving change both here in New Jersey and across the globe. And in fact, a key part of the mission that Rick has chosen and this group has chosen is to notice that New Jersey is part of the rest of the world. So Global Health Institute is not only restricted to international health, but includes domestic health, including in New Jersey as well. By promoting collaboration across all sectors of Rutgers, we're making strides toward our goal of being one of the very best academic health centers in the nation and creating healthier communities everywhere. Today's meeting is a testament to that work, and it's an opportunity to see how Rutgers Global Health Institute's efforts. As many of you know, the Institute is currently reviewing its strategic plan, which I have a chance to review today. This will be a roadmap for amplifying our efforts to bring high-quality, equitable healthcare to those who need it most. And in a special highlight, we'll be launching the Rutgers Global Health Institute Champions of Global Health Award, which will recognize the exceptional faculty, staff, students, and volunteers dedicated to fighting health inequities, as Rick foreshadowed. We couldn't do any of this without the passion, dedication, of hard work of individuals like you. Your contributions, whether in research, education, community outreach, or patient care, or making these achievements possible. We're building a healthier, more equitable world. Thank you for being here today and for your continued commitment to this vital work. I know that we'll all gain valuable insights from today's discussion.
Thank you, Brian. Everyone's on mute, otherwise we'd be applauding, but thank you. And I wanted to add my welcome and good afternoon. Have we not been blessed with wonderful weather these past few days? Just wonderful. But our thoughts and prayers go out, though, to those in Florida and North Carolina who have suffered the devastation of hurricanes made worse by global warming. As we at Rutgers know, global health is about addressing health equity locally and worldwide. It's also about recognizing that our local neighborhoods and communities are interconnected with all communities around the world. So global warming is obviously one of the biggest examples of that interconnectedness. And we at Rutgers recognize that we have to take care of each other. We have to be part of creating the conditions for good health for all communities. So again, I'm excited to see all of you here at the membership meeting. As Brian outlined in his remarks, we're covering a lot of ground, so let's get started. Again, please use the chat function and we'll get to your chats or your questions or your comments at the end. This is our, I'd say, old mission, although it still remains in principle and in spirit. We've just honed down, as you'll see, the wording rather than have a long wording that really was about improving health for the most vulnerable, and the three ways that we would expand our efforts, our three goals. Really, we've honed our mission down to one sentence, and you'll see. But those of you here as part of the Institute know, you've been here for a while, you know what our mission is. But let me just start to say, who the heck are you? Who's here? Well, the Rutgers Global Health Institute, we have greater than 180 members. And there's several types of members that are here on the Zoom today. And you have core faculty members. You, as you know, are faculty from across all the schools and institutes of all 4 chancellor-led units at Rutgers. You are professional members of the Global Health Institute, professionals that are at Rutgers, coming from, again, across Rutgers, but share the same mission to do something about health inequity. And you are affiliated faculty members that are global health collaborators of the Rutgers faculty, which could be at any institution. You are also our Impact Council. The Rutgers Global Health Institute Impact Council was formed in 2017 when Rutgers Global Health Institute was launched. The council has diverse members listed here in alphabetical order, and they're composed of volunteer professionals who have been working in global health or health equity areas for many years, and who are interested in the mission and the work that you all are doing at Rutgers. We thank them for their devotion, their advice, their creativity, and frankly, their willingness to roll up their sleeves and help us achieve our goals. You are also our staff, shown here. Oriana Culpert, who does research with Gwen Lee, who you'll hear from. Florencia Mardonell, who works with Kevin Lyons at the Business School on Resilient New Jersey program and runs our SEED grant program, which is now open. And among other things that she does, Isabella Rodriguez, who helps with program organization and program development. The Botswana Rutgers Partnership for Health works with the government of Botswana on cancer care inequity via training, research, and capacity building. So through a global oncology fellowship and through pathology department partnerships between University of Botswana and Rutgers Cancer Institute in New Jersey, via folks here, Tina Mayer, Deb Topmeyer, David Ferran, Lori Goodell, many others. We have a partnership with the academics and with the government of Botswana. So you are us. This is a picture when we had a meeting, a membership meeting in person, there with Brian in the front, but many of you can see yourselves here in an in-person meeting, which we hope to have next year. This is really, we represent global health across Rutgers. And one way we do that is, this doesn't represent every one of the many hundreds that work in global health across Rutgers, but we have a global health collaborators network. And those are the 11 or so centers or efforts that are organized by different schools across Rutgers, again, under all chancellors, that focus on global health. So we get together every quarter and talk about what we've done and what we want to do. So we communicate and also hopefully collaborate. This is part of our function as an institute to be a convener and catalyst for global health activity across the university. So you're going to hear from a representative from each of these collaborating networks or centers across Rutgers right now. First, Michelle Stevens. There
Good
you are.
afternoon, everyone. I'm Michelle Stevens, and I'm the founding and executive director of the Institute for the Study of Global Racial Justice, which we call ISGRJ. I'm also a professor of English and Latino and Caribbean Studies in Rutgers University, New Brunswick. Really happy to be here. Thank you so much for starting things off with me, Rick. I'm going to say a little bit about the Institute. The ISGRJ really serves as a kind of university-wide intellectual corridor, bringing together scholars from law to language, from history to art, and from health equity to criminal justice, and providing them with a platform and an intellectual community. We recently launched 3 initiatives I thought I would mention. The first is the Rutgers Researchers on Race, or R3 database. This is an interdisciplinary directory of scholars, faculty, and students engaged in scholarship on race, including researchers on health inequities from various Rutgers schools of medicine, public health, communications, and arts and sciences. The second initiative is called the Justice Archives. It's a searchable, comprehensive, interactive, and inclusive depository of events and research projects undertaken by Rutgers faculty with the support of ISGRJ. And the third is Just Takes, an op-ed writing initiative encouraging faculty to share reflections on current issues in global racial justice by drawing insights from their research. Thank you very much.
Thank you, Michelle. Again, we'll have times for questions, comments, and please, you can keep track of your own questions, comments in chat. But next, Harsha.
Hi, everyone. My name is Harsha Sule. I'm in the Department of Emergency Medicine at New Jersey Medical School and in our Office of Global Health. Pleasure to give this update on behalf of our school. We have multiple areas that we are focusing on currently at the undergraduate medical education. We are involved in delivering didactics within the med school curriculum, as well as a robust distinction in global health program that has on average about 4 to 6 students graduating each year with distinction in global health, which is an academic effort, includes scholarship as well. At the graduate medical education level, we have multiple residents and fellows that are involved in global health activities. Most recently, one of our medicine pediatrics resident, MedPeds residents, and a cardiology fellow taught a course in Ghana over about 2 weeks ago. And at the faculty level, while there are numerous faculty that are involved in global health, ranging from members of the TB Institute to other faculty as well, I want to highlight our most recent program, which was in Ghana. This is in addition to several other countries we're involved in. And as a result of our projects in Ghana, we have now trained over 50 local providers in point of care ultrasound, over 100 in basic and advanced life support systems, as well as delivering surgical care to probably about 80 local residents each year for over 5 years now as well. And we've also taught Stop the Bleed courses to several local individuals, including school children as well. So a lot of our focus is on education here, but also in the delivery of healthcare.
Great. Thank you, Dr. Sule. And we'll get to Dr. Lin.
Hi, I'm Karen Lin, Associate Dean of Office of Global Health at Robert Johnson Medical School. I'm a professor of Department of Family Medicine and Community Health. The Office of Global Health is offered diverse initiative to enhance global health education and engagement. Our distinction in global health program allows students to lead impactful project. Chancellor has offered a scholarship from 2015 to 2020 to recruit the most talented medical student And so far, 20 global health scholar has graduated from 2019 to 2024. The other 18, they don't have a scholarship, but they also graduate with distinction in global health. And their impactful project, I just quickly mentioned 3 of them. One is Asylum Clinic, started 2022. We partner with the legal services in New Jersey and New York, and provide physical and psychological evaluation for clients who seek asylum. The Veggie RX is a prescription program to promote connection between fresh fruits, vegetables, and health. It's established in 2018, and now we finished the 6th season. We partner with New Brunswick Community Farmers Market, Rutgers Johnson Medical School, Promise Clinic, the Elijah Promise Community Kitchen, and also the Rutgers Ecology. And there's another program is a Health Passport and Healthy Living program, also is by one of the scholars to teach the resident a path to better health. We also have the MOUs with international partnership. We just added 2 new sites in Guyana this year. And the faculty recruitment, we also secure the scholarship in mission-driven global health experience. And our primary in global health course is teaching the graduate student. For our capacity building for international partners, we work with the Jimma University of Ethiopia and University of Dodoma in Tanzania.
Great, thank you, Karen. How about Matthew?
Hello, everyone. Good afternoon. My name is Matthew Mataganis. I'm an associate professor at the School of Communication and Information here at Rutgers, and I'm thrilled to share with you a snippet of the research my colleague Itzhak Yanovitsky and I have been engaged in, inspired in part by our international collaborations with other Rutgers Global Health Institute affiliated faculty, including colleagues from the School of Health Professions, with whom we're doing work in Greece and here in New Jersey's diverse communities. So recent epidemics and, of course, climate change-related disasters, unfortunately, continue to remind us that health communication is essential in addressing global health challenges, but also pursuing international development. And these realities sort of drive home for us the need for a global health workforce with competencies that now go well beyond the design, dissemination, and evaluation of health messaging, although, of course, those remain quite important. So the main goal of our project is to lay the foundation of to creating a program here at Rutgers that can support the development of such a workforce. So we, through a mixed method research design that involved a scoping review, content analysis of job ads, academic program materials, but also interviews with key informants, all with years of experience in academia, government and intergovernmental organizations, and of course the private sector. We saw that there are important gaps, rather plural, between those communication competencies required in the field and across sectors, and those and what exists and what existing training programs rather offer today. And so it's also abundantly clear to us that we need traditional and just-in-time training, and we need to also expand our offerings when it comes to experiential learning opportunities as well. So we strongly believe that there's a significant opportunity here at Rutgers to leverage existing capacity across units and programs to establish what we call a robust but also sustainable training programs, both for internal and, of course, a diverse set of external audience too. Thank you.
Thank you, Matthew. A lot going on. And next is Riva, probably one of the first global health faculty I met at Rutgers coming here. Riva.
Thank you. That's giving away something about my age, I guess. I'm Riva Tauger-Decker. I'm a professor and associate dean for global affairs in the School of Health Professions and a professor at Rutgers School of Dental Medicine. SHP, along with Sky, have been working with Democritus University of Thrace in Greece, where Dr. Strom actually has an honorary degree from, on a short course for this spring that we're very excited about, on interprofessional practice and communication in healthcare in the US and Greece. That'll be in Alexandroupolis, Greece in May 2025. Also with Sky, we've had an international academic partnership program initiative with Greece since 2000, and as part of that, we've instituted courses aimed at capacity building with 3 other Greek partners. We're also working as SHP with the International Medical University in Malaysia on several academic initiatives focusing on health informatics, nutrition, and dietetics. And Dr. Shristi Rawal, also a core member of RGHI and an assistant professor in SHP, is conducting a clinical trial at Dukil Hospital, Kathmandu University in Nepal, looking at the acceptability and preliminary efficacy of a mobile health intervention for gestational diabetes. That's among the key areas we're working with. Thank you.
Thank you, Reva. Amelia, Assistant Dean, School of Nursing.
Yes, hello everyone, and greetings from Nigeria. I'm here attending a meeting on workforce. So I am the School of Nursing. Our unique study abroad program is interdisciplinary. We accept students from all healthcare professional schools across Rutgers, our campuses. So we do 3 programs each year. This year we are collaborating with University of Dodoma in Tanzania, Argentina, we go to University of Austral and Ghana. We go in a little bit, we are in Kumasi at Garden City University College. The collaboration in University of Botswana gave birth to a collaboration at the School of Nursing there. They are mounting a new oncology nursing and our faculty are helping them to implement that. We also host visiting scholars. One just left for Nigeria, a Fulbright scholar, and then we're expecting 2 more from China next month, and throughout this year. So we give back to our collaborators during visits. Our students learn skills like Stop the Bleed, which Harsh has mentioned they do in Ghana as well. We teach that at all the schools where we go. And we also accept their faculty when they come to be able to present to our faculty and staff here, as well as give them a tour of the school. Lastly, we run trainings for their clinical preceptors and also do quarterly webinars for faculty, because sometimes it's not easy for their students to come here. We engage them through these collaborations. Thank you. And that's the School of Nursing.
Thank you, Dean Amelia. Next, Rebecca, School of Social Work.
Hi, I'm Rebecca Davis, and I'm Associate Professor in the School of Social Work. I also direct our global social work programs. So our school is one of the largest schools of social work in the country. We offer degrees at the bachelor, master's, and the doctorate of social work, as well as the PhD. In online formats, intensive weekend, as well as our traditional programs. We have campus-based courses in global social work and social work with immigrants and refugees, which a lot of our students work in. Our students are also engaged in community-based practicums in Pennsylvania, New Jersey, and New York that include health, mental health, and social services. Our study abroad programs include service learning in Romania, health and social services for sex workers in India, community health and social work in the Yucatan, Mexico, meditation and social work in Taiwan, and child welfare and Latinx studies in Puerto Rico. I myself represent the International Association of Schools of Social Work to the UN and serve as a member of the Working Group on Girls. And our work is really to advocate to amplify the voices of girls within the UN system. Thank you.
Thank you so much, Rebecca. And one area that supports all of us in international work, faculty, students, and otherwise, Rutgers Global. Rick number 1, Rick Garfunkel.
Don't know if I'm Rick number 1. I would say you are, but okay, I'm Rick Garfunkel, Vice President of Global Affairs and a Professor of Chemistry and Physics. Concerning our global presence overseas, as you know, Rick Marlink and team have a long-term partnership in Botswana, and I have joined them there 3 or 4 times in the past. I have my own sort of long-term interactions there as well. Rutgers Global has a lead person in Beijing, another person in UK and Spain, and you're happy to work with those people if you're ever traveling or need partners there. After an extensive discussion with EVPA Moge and President Holloway last fall, we were encouraged to move forward cautiously with setting up some new sites abroad in India, South Korea, and Ghana. In India, we have decided to work first with Institute for International Education. This is the 600-person nonprofit that oversees Fulbrights and about 100 other programs. We're very close with them on many activities. For example, the Afghan refugee, we have about 20 Afghan refugees here. We work with them on that and other systems. I'll be headed to India with Mohini Mukherjee in a little over a month. And there'll be a couple of Rutgers health colleagues there, Smita Thakurvaria, Doreen Mareka, and possibly Sabiha Hussain. Jiang Zhang, who is an Assistant VP of Global Affairs here at Rutgers Global, is leading a delegation of mostly Rutgers health people to South Korea in a week to meet with university, government, and private sector partners and attend 2 or 3 conferences and symposia, and meet with high-level alumni, including president of Seoul National University is a Rutgers grad. Kathy Scotto and a dozen people from across Rutgers Health will be joining, I think 7 from the School of Pharmacy. In Ghana, a couple of groups have gone over the past year. I was part of one of them, and I think some of you may actually have been in 1 or 2 of those events. We have the possibility, and we're thinking about how, if and how to open up a small office there. I should mention that we will have the next round of global grants now. So you have, I think they were just launched yesterday, actually, and one of the fields of these global grants, these are small starter grants up to about $10,000 each over a 2-year period. You can go to our website and find out about applying for them. And Rick Marlink himself is overseeing one subset of those grants. Thank you.
Thank you, Rick, number 1. Next, School of Public Health, Vince Silencio, Professor.
Thanks, Rick. Rick 1 and Rick 2. Hi, everyone. I'm Vince Silencio from the School of Public Health, Professor of Urban Global Public Health in the school. We have a ton of work going on in this space, so I apologize already to my many colleagues from the school who aren't all represented on this slide. So just trying to get it all in. We are happy to point out that the global public health concentration has now become the largest in the School of Public Health. We have over 100 graduate students in the program, drawn from 6 continents. We're only missing Antarctica. So if anyone has connections there, please, we'll happily entertain applications. Just a few selected projects and works. We have a new course on public health in the Caribbean, launching this spring, led by Dr. Fredericks James, who is on the call. Dr. Fredericks was the former chief medical officer for the country of St. Lucia, and so we're very happy to have that course started up. We have another course in development for the summer, next summer, in Colombia. Dr. Figueroa, I think, Perez Figueroa is also on the call. Our courses in Greece will continue. And closer to home, we have some work that we're doing in collaboration with the School of Pharmacy faculty, the Greater Newark Healthcare Coalition, and the Rutgers Health Service Corps as interprofessional education experiences focused on reducing pediatric asthma morbidity and mortality in the Newark area, planning also to expand that across the state. We, in the research space, Dr. Schwander still is working on the ground in Kampala, Uganda, on a project on TB and air pollution, an excellent example of a community engaged research project with academic and community partners there. And then on the education side, we continue to do some work on looking at innovative applications of AI in public health research, education, and practice, including some work presented internationally in Rome over the summer on building AI partnership teams for use in emergency response settings, and then have some work in progress with colleagues in Silicon Valley and the tech industry to expand our work in these spaces. And so apologies again to folks who I have neglected with this slide, but it is just the tip of the iceberg of the work going on within the school. Thanks.
Thanks, Vince. So just to continue to answer the question, who the heck are we? In the last 3 years, we've added on a new category of who we are, and that's the recruitment of principal faculty to Rutgers Global Health Institute. So far, there are 5 principal faculty to date. And now, just to continue drinking from the fire hose, we're going to hear from them about their work. So we'll start with, here's the list, and we'll go in this order. And Ubaidul, Dr. Haig.
Good afternoon, everyone. I'm Ubaidul Haq, an assistant professor at Rutgers Global Health Institute. I'm currently leading a project addressing vaccine hesitancy through the innovative use of social media data collection, machine learning algorithms, and targeted interventions in Alaska. Despite the significant challenges of working in this last frontier, our efforts have achieved remarkable success. We have expanded our research to cover 95% of the population centers in Alaska, a substantial increase from our initial plan to engage only 4 locations. This initiative is particularly timely given the recent New York Times report highlighting Alaska as the least vaccinated state in the United States. In addition to my work in Alaska, I'm implementing a project in Ukraine that investigates vaccine confidence and vaccination uptake to promote health equity during the ongoing conflict. Another study investigates the impact of Russian drone attacks on the sleep and mental health of the civilian population as an invisible threat. Thank you.
Yeah, Dr. Hawk picks the easy places to work. Alaska and vaccine hesitancy, and post-war Ukraine predictions and ongoing issues for civilians and medical personnel in Ukraine. Great work. Next, we'll get to Umar. Recently got tenure.
Yeah. Hello, everyone. Thank you, Rick. I'm Umar Hassan. I'm an associate professor of electrical and computer engineering and a principal faculty at Global Health Institute as well. I joined Rutgers back in 2018, so it's been 6 years. And as Rick pointed out, kind of a newly tenured associate professor, so still getting the feel for it. Here's my name of my laboratory, LEMF, I call it. It's Laboratory of Immunoengineering and Micro Nanotechnologies for Personalized Healthcare. And we are on a mission, hopefully not mission impossible, mission possible. And the mission is to develop these next generation biosensors for infectious disease diagnostic applications with a strong focus on the translational activities of these sensors, especially not only in the US, but also the global health settings of the world. Here are a few products that have come out of my lab over the past few years. Right under my picture, we have a very beautiful 3D printed handheld fluorescence microscopy system. And the image that you are looking at on the top of a smartphone, every single dot is a white blood cell. So we can, at the point of care, quantify white blood cell, and it opens up a lot of different applications. Another sensor that we are developing, and that is in collaboration with Robert Wood Johnson Medical Hospital, with the ER department, Jonathan McCoy and Paul Peng, where we are trying to expedite the ER patient triage and improve the specificity of sepsis diagnosis. Another sensor that is coming out is to quantify rifampin more for the TB management, and it's a collaborative project in between University of Virginia, Rutgers Newark and New Brunswick campuses, and also in Tanzania. Across all of the projects, again, technology translation is a core component. So we file patents, license the technology, startup companies, all of that also goes along with this. And here's finally the list of the agencies who have supported my work. So special thanks to, again, Rutgers, Rick, School of Engineering, RBHS, everyone, and external funding agencies that has really made a case of my tenure too. National Science Foundation, NIH, New Jersey Health Foundation, and Office of Naval Research too. So I'm really glad to be here. Thank you.
Thanks, Umar. And Gwen Lee, also one of our first courageous principal faculty.
Yeah, I think maybe I was the second after Umar. So I joined the Global Health Institute in 2022. I've been here for just over 2 years now, and excited to share some of the work I've been doing with Dr. Shauna Downs at the School of Public Health. We were recently awarded a new R01 to examine school food environments and adolescent nutrition in Nairobi, Kenya. In addition to that, I'm continuing to investigate interactions between enteric exposure and dietary intake as they affect the growth and development of children in developing countries, and continue to support the United Nations International Atomic Energy Agency on studies where we use stable isotope methods to understand how nutrient absorption may be altered among malnourished children. So we've really appreciate the support of the Global Health Institute, the School of Public Health, and RBHS. Thank you.
Thank you, Gwen. And Tara, probably the most recent principal faculty coming with us.
Hi, everyone. I'm Tara Freewill-Klingner. I am actually coming up on my 1-year anniversary of being here. So it's almost been a year that I've been part of Rutgers Global Health Institute. Thanks so much for having me today. My work primarily focuses on global cancer prevention and early detection in sub-Saharan Africa. I have collaborated with the Union for International Cancer Control on their publication focused on integrated approaches for women's cancers, opportunities to advance health for women. I have also been working with the Botswana-Rutgers Partnership for Health. With this partnership, we explore geographical access to cancer care in Botswana. We have a recently published manuscript in JCOGO. We also assess cervical and breast cancer services at 4 public oncology centers in Botswana and presented these results at the 12th Annual Symposium on Global Cancer Research this past May. In progress, I am working on a secondary data analysis for a prospective cohort of breast cancer patients from the multidisciplinary breast clinic at Princess Marina Hospital in Gaborone. With this project, I'm collaborating with Dr. Yehuda Marte at the University of Pennsylvania. Additionally, I'm co-leading work with Dr. Kelly Kohler from Rutgers Cancer Institute at a tertiary hospital in Mwanza, Tanzania. This past summer, we were able to travel to Tanzania and Botswana to meet with our collaborators and colleagues to further these projects. This trip included discussing my recently submitted KO1, which is focused on implementing a breast cancer early detection intervention in Botswana. Thanks so much.
Thanks, Tara. And last but not least, Bobby Brooke Herrera from New Mexico.
Thanks, Rick. So as Rick mentioned, my name is Bobby Brooke Herrera. I'm an assistant professor jointly recruited by the Rutgers Global Health Institute, Rutgers Robert Wood Johnson Medical School Division of ID, Infectious Diseases, and the Child Health Institute of New Jersey, where my lab is based. I lead a diverse team of researchers, including a postdoc from Ghana and a few Rutgers PhD students and undergraduate students, along with close international collaborations from Brazil and Nigeria and Senegal, all driven by one mission to uncover why some people suffer from severe disease while others don't. Our work focuses on mosquito-transmitted viruses, which impact the United States, like La Crosse virus, and especially the global south, like dengue, Zika, and chikungunya. With support from both government and foundation grants, some of which are listed on this slide, we aim to develop new tools, such as rapid diagnostics and vaccines, and knowledge to improve health outcomes worldwide. Thank you.
Great, thanks, Bobby, and thanks to all the principal faculty. I'd like to, I guess, update everybody on our strategic planning reboot or strategic planning process to date. This will be your opportunity, not just during this meeting, but following this meeting, we will send you the draft strategic plan, and there'll be a formal response or questionnaire, Qualtrics, that you can then give your comments or ideas. But the process so far, number one, started with a writing group. You got to write something down, then you can draft and change and comment on. But writing group was a principal faculty and senior staff members focusing on the mission mission, vision, values, goals, and objectives. We simplified the mission statement to read here from what you saw at the beginning and what's in our present mission statement. Very simply, the mission is we deliver health equity solutions locally and around the world. Our vision is the same. We hope for a world in which every community is healthy and thriving. Second, we also, or simultaneously, we reviewed the global health programs, missions, and strategic plans from peer institutions at AAU and also US and international institutions with similar global health efforts or institutes at the Consortium for Universities for Global Health and elsewhere. Our values are listed here. They haven't changed from our first strategic plan. It's good that values don't change. I think that's like Vice President Harris. Their values have not changed. And we believe in transformative impact, comprehensive approaches, partnership. You can't get anything done in public health or global health without partnership, and mutual learning from each other, and creating purposeful solutions that actually have impact. We have looked at, in the strategic planning process, to have 3 areas of impact. We will continue to promote the diverse global health endeavors across all Rutgers schools and focus on impact as long as it improves health equity. But these 3 areas are areas that we think are complementary to what's going on around Rutgers and to our faculty. So we have cancer prevention for all, healthy children, thriving communities, and infectious disease solutions. And you can read more about the explanation that'll be in the draft strategic plan, but some of the wordings here. So the approach, like really a public health approach, is that we have to have a multifaceted approach to actually have impact, whether it's in these 3 areas or any areas that you all are working in global health. And that multifaceted approach involves community engagement, partnership, investigation and discovery, innovations and solutions, capacity building, and multidisciplinary teams. Now, you may not have all these going on at once, but really a multifaceted approach is the best way to confront health inequities from these different angles. The strategic planning process also had a Rutgers-wide and actually a public survey that was available in the summer. So many of you responded to that. These are the folks that we specifically reached out to in the bottom list. Plus, again, it was open to the public and on our website and on our social media. The results of those surveys are available and will be summarized in the strategic plan. So I know that's not a strategic plan meeting. It's just to give you the, I guess, the taste of what you'll be looking at if you want to look at the draft plan and give input. What I'd like to do now is something that's brand new and celebratory, and we hope fun and interesting. And that is, we've created the Rutgers Global Health Institute Champion in Global Health Award. And this is an actual award, although we're a virtual meeting. So this is a picture of the award on the right. It's a pretty large crystal pedestal with engravings of the awardee and Rutgers engravings on the pedestal, but then a revolving crystal globe at the top, sort of floating there. I'm not going to mail these to the awardees because it's very heavy, but we will be giving them to the awardees, and hopefully they'll have a sturdy mantle to put them on at office or home. But that's the award itself. This award is given to Rutgers faculty members, staff, students, or volunteers who have led us in addressing health inequity, either at home or worldwide. The 3 awardees that you'll hear about were selected are examples of champions in our global fight for health equity. We should note that a separate award presentation earlier this year gave the Champions in Global Health Award to someone many of you know, Laura DeMio Hoyt, our manager of communications. Now, given out in alphabetical order, we're proud to acknowledge these individual champions in global health. The following three individuals, again in alphabetical order. We hope that at the end of this presentation, everyone will unmute and we'll have time to join the recorded applause in the video. But we're going to run the video with the three presentations in a row, and then at the end, we'll all be able to applaud our awardees. So without further ado, our first Champion in Global Health Award goes to John DeMonte. John DeMonte is a committed, born and raised New Yorker, but his work has taken him around the globe where he has developed programs addressing health inequities in HIV/AIDS and in cancer care for children. For many years, John has led the Bristol Myers Squibb Foundation. So for the past 30 years, John has spearheaded programs that have literally changed the scope of our world's global HIV/AIDS response. A major initiative of the foundation was Secure the Future, launched in 1999. This effort was the largest response to HIV/AIDS the world had yet to see, launching a $100 million commitment from the Bristol Myers Squibb Foundation to programs in Africa. At the time, this financial commitment was larger than the entire U.S. government's domestic and international efforts against AIDS combined. To date, the program has funded over 240 projects in 22 African countries. Another of John's notable initiatives through the Bristol Myers Squibb Foundation in partnership with Baylor Children's Hospital is Global Hope. Global Hope focuses on caring for children with cancer in Africa and trains African clinicians to be pediatric oncologists. Global Hope recently celebrated the treatment of its 10,000th child with cancer. Throughout his career, John has brought hope to countless individuals across various settings internationally, ensuring that many who would otherwise have gone without support now receive the care they need. Because of these worldwide efforts to change how we approach both AIDS and cancer treatment in poor settings, we are honored to present John DeMonte with the Rutgers Global Health Institute's Champion in Global Health Award for 2024. The next Champion in Global Health Award goes to Brent Rubin. Brent Rubin was raised in Des Moines, Iowa, and pursued his undergraduate, master's, and doctoral degrees at the University of Iowa. In the 1970s, Brent joined Rutgers University, where he advanced through various roles in the Department of Communication and Information. He founded the Center for Organizational Leadership at Rutgers and played a pivotal role in establishing the Rutgers Global Health Institute. Alongside Sherry Trump, Brent volunteered to meet monthly with the Institute's staff and faculty during its first year and a half, guiding a university-wide strategic planning process. Professor Rubin's insights were instrumental in shaping Rutgers' definition of global health, emphasizing that it encompasses both local and international dimensions. With his guidance, all 29 schools and colleges of Rutgers were able to be engaged in the strategic planning process, paving the way for their involvement in the Institute's activities and core faculty we have today. Additionally, Brent and the Center for Organizational Leadership were critical in partnering with Rutgers Global and our institute to conduct two significant leadership summits with the very top leaders from the government of Botswana in 2019 and 2020. Today, Brent, Morit, and Ralph at the Center for Organizational Leadership continue to support us behind the scenes with our current strategic plan reboot, and we are deeply grateful for their ongoing efforts and are honored to present Brent Rubin with the Rutgers Global Health Institute's Champion in Global Health Award for 2024. Our third Champion in Global Health Award goes to Professor Michelle Stevens. Michelle hails from Jamaica. She joined Rutgers in the spring of 2011 in the Department of Latino and Caribbean Studies and holds a PhD in American Studies from Yale. She is also a psychoanalyst and publishes work on the intersection of race and psychoanalysis. To those that know her, it is known that she accomplishes more in one day than most of us do in a week. Adding on to an illustrious career and leadership positions, she recently took on as the founding director of the Rutgers Institute for the Study of Global Racial Justice, which serves as a vital conduit for new knowledge and ideas. The Institute provides opportunities for faculty and trustees to collaborate across disciplines in addressing issues of race and social justice. Racism, in all its forms, poses the greatest barrier to achieving health equity here and worldwide. Michelle and the Institute for the Study of Global Racial Justice have actively engaged with the Rutgers Global Health Institute to make this issue a priority when confronting health inequity. Through the initiative Black Bodies, Black Health, Professor Stevens partnered with Anna Branch, Senior Vice President for Equity at Rutgers, to fund grants, workshops, conferences, and scholarly writing aimed at addressing structural racism to create more equitable health outcomes. Racism fuels the social and economic inequalities that lead to health disparities both in the U.S. and globally. And the partnerships that Michelle has fostered to explore the intersections of racism and health have proven both fruitful and impactful. As a 2024 Rutgers Global Health Institute Champion in Global Health, Professor Stevens demonstrates that addressing structural racism will be essential for achieving health equity, not only in the U.S., but worldwide. For applause, everybody. For all three. We're on mute, but you can see the applause and the emojis, the applause emojis. Thank you so much. I'd like to ask our three champions to say a few words now in order to start with John DeMonte.
Well, thank you, everybody. Thanks, Rick. I greatly appreciate it, and congratulations also to Brett and Michelle. I've been working with the Rutgers Global Health Institute since it was established in 2017. But as Rick had kind of mentioned, I've been working with Rick for over a quarter of a century. And I first met Rick when he was one of our first partners when we got to Sub-Saharan Africa and started to work in Botswana. Also on the Impact Council, also on this call, is Jeff Sturcio, who was running the Merck Foundation at the time. And I think there was a real global response to HIV, which was heartening. Even though it took time, we were able to see that epidemic, which at the time was about 39% infected in the adult population, 15 to 49 years old, turn that into more of a chronic condition and allowed people like Rick and myself to kind of change our focus and think about non-communicable diseases as people were living longer with the virus. So Rick, thank you very much. It's great to be a partner with you now and going forward. Although we don't have another quarter century left in our gas tank, I do look forward to working with you on the strategic plan and your implementation going forward. Thank you.
Thanks. You probably do. I don't know if I do. But and also thanks to our Impact Council that John one of the leaders and one of the first ones of our council. Thank you, John. And Brent, I don't see you on there you are.
Yeah, I'm there. Well, thank you so very much. What an honor to be recognized in this way by the Institute. The Institute is such an important group within Rutgers Health and within the university overall, really a signature unit, making a major difference and standing for really critical issues. And I think also it's important to recognize and I'm very grateful for having had the opportunity to work with Rick Marlink, who I don't know if this is Rick 1 or 2, but it's Rick M. in any case, who obviously is internationally known and admired for his work globally as a health pioneer. And a wonderful person, simply amazing, dedicated. He always brings to my mind the image of the Energizer Bunny. He's on a mission, usually multiple missions, and he simply keeps moving, bringing others along with him. I was happy to be able to contribute some ideas that I think help the Institute with the structure and process for addressing what is an enduring problem at a vast university like Rutgers. That's 1,000 beautiful flowers blooming, but not nicely arranged in a garden that is easily seen or easily accessed. I actually suspect Rutgers is a world-class leader in this regard. So the challenge of how you create a well-organized garden that fosters collaborative networking, synergy, and vitality, this is quite a challenge. And I think initially, as Rick looked at the opportunities here, it might have been a moment of being a bit like a deer in the headlights. And so how do you do this? How do you implement a structure and communication channels to make this all possible? And now with over 175 faculty, as I understand it, all woven together in a fabric that leverages incredible strengths of Rutgers Health and Rutgers University more generally. It's been an experience where I've learned a great deal. It's been an honor to be involved and a pleasure to contribute to this important work. And just thanks so much to Rick, to Brian, and all the colleagues for this award. More generally, thanks for the opportunity to be involved. I know that I've benefited personally and professionally at least as much as I've been able to contribute. Thank you all very much.
Thank you, Brent, and thank you for just basically working your butt off to help us do that organizational work and get started and continue to help us along with Sherry and Ralph and Marit and the whole Center for Organizational Leadership. But thank you. And last but not least, Michelle, who's opened my eyes and many others in big ways. So Michelle, can you say a few words for us?
Of course. Thank you, Rick. I'm really honored to be receiving this award. I was really pleased and surprised when you let me know. So my thank you to the Rutgers Global Health Institute. My congratulations to my fellow awardees, John and Brent. It may seem obvious to all of us how an institute that focuses in health and an institute that focuses not just simply on race, but from a humanistic perspective would have something to converse about. But when you actually try to put that together, it's challenging, right? We work in very different parts. The humanists and health researchers work in very different parts of the university, right? It's not as easy as it sounds to think about how we might collaborate. I could not have thought about that without Rick, your help, Rick Marling's help, and being invited to be a part of the Rutgers Global Health Institute community so early on was really instrumental for helping me try from my perch to think about how to create a conversation, or really more how to make visible the different kinds of conversations that are possible between our different communities of researchers, many of whom overlap, which is what I'm very proud to say that with RGHI's help, I feel like we have actually created some of those networks over the course of the last few years of ISGRJ's existence. For example, I was really pleased to work even very directly with Rick and wonderful colleague, Arpita Jindani, as we work together on some small grants, working on creating training modules for anti-racist teaching within the health equity space. That's just one example of the kinds of projects that kind of have emerged out of our work together. I also just personally, Rick, want to thank you for your mentorship as a leader. I think I really looked to what RGHI had created, the challenge of creating this multi, campus, university-wide entity that is a gathering space for multiple kinds of scholars. I think, Brent, you're exactly right, that can be very, very daunting in the kind of highly decentralized Rutgers landscape. And from the second that Chancellor Strom suggested that Rick was one of the people I should speak with, it's been nothing but helpful, inspiring, guiding for me to look at the model you've created here, all of you together at RGHI. So I just also want to thank you personally for helping to kind of bolster my own efforts to create something similar in the space of the ISGRJ. So very honored. Thank you very much.
Thank you, Michelle. And you point out too, though, we have a lot more work to do. So this is sort of the tip of the iceberg, honoring these three folks who are working in different areas that help make us better at addressing health inequities. But we have a lot more work to do. There's a lot of folks here that I will get to now in the chat too, that we haven't heard from, but thank you all three, and you'll get that heavy crystal award probably delivered personally, because I can't mail it. It'll cost too much money. But thank you. Just to wrap up now, but maybe we can applaud just to, I see folks are still here, and I'm applauding for you, and we're doing it silently with some people with mute, some people without. I see Shrishti turned her mute off and on. Some people are there. It's so great to see everybody. I'm looking over at another screen, but there's so many that are involved in global health across with their own efforts and their own groups. Let's get on to hearing from them too during the chat. But thank you, three. And just 3 more points to go forward. This is the wrap up. We wanted to make 3 points at the end. One, we'll be finalizing the strategic plan. So with the Qualtrics survey, it's an opportunity after this meeting to either open-ended text or email me. Either way, you'll get a copy of the plan if you attended the meeting, even if you don't fill out the Qualtrics. And we want your feedback. The second is if you know anybody that would be a great fit for us, you know now who you are. We went through each type of category of members, but these members include faculty, staff, affiliates, professionals, all that want to focus on our mission. And that's on health, addressing health inequities. And lastly, as Rick Garfunkel said, our seed grants are now open. Florencia would love for folks to apply. You go to Rutgers Global website actually to apply for the global health grants or for the other seed grants. So those are the 3 wrap-up points I wanted to make. I do want to thank everybody for being part of this meeting. You know how to get a hold of us or our website or social media, but you can also just email me or call me. There is a special thank you to Melanie Camacho, who's administrative coordinator at Rutgers Health. I don't know if we're supposed to say RBHS anymore, Melanie, but Rutgers RBHS Faculty Affairs. She came on to really help us organize this meeting, bringing us all together. Hard work and dedication. Thank you. Also, I didn't know she was a filmmaker. So thank you, Melanie. And with that, I'd like to see Florencia or Melanie, what you have in the chat and what we have for Q&A. So I'm going to stop sharing and everybody can see each other. I know we have a lot of folks, from the TB Institute. We have Mayer Narayan, I think I'm looking around, he just had a big summit meeting on about emergency and first responders in 9/11, the first teams meeting. There's other global surgery things going on. We have a new member with Dan Hausman, bioethics. We have Barbara DeMarco, who helps us with workforce development, but also helps with our badging program. We've had how many 53, 54 different badges for global oncology training in Botswana. Tina Mayer. I'm just looking at who's here. So what do we have in the chat? I see in my screen, I see Amelia in Nigeria, my main screen.
We do have a question in the chat. It's actually for Dr. Stevens, so Dr. Michelle Stevens. Dr. Purcell was wondering if your Just Takes program also welcomes pieces from students, or your Just Takes initiative.
Sure, we'd be interested, definitely. Encourage students. I mean, primarily the focus is more on faculty, researchers, postdocs, graduate students, definitely. And so graduate and professional students for sure. And then if there are undergraduates who you think might be able to produce something that would be good for this, definitely send them our way.
Oh, Mayer did get into the chat talking about trauma. Sorry, I didn't follow the chat. That's why I asked Florencia and Melanie. And
yes, his comment came when you were presenting the 3 areas of impact.
yeah.
If anyone have any question or comments, you can unmute yourself or raise your hands. Any other questions, comments?
I can't believe Professor Robson is quiet. I know I
can't either.
I know I can tease him. I know I can tease him.
I know you can. And, you know, I can't believe I'm quiet either. But, you know, having become a dean, as several of you are, I've learned, Rick, after 51 years here, it's the first time in 51 years that I've learned to be quiet. It saves a lot of follow-up emails. It's just, but this, I mean, congratulations to the 3 wonderful winners. You know, I always look at Dr. Rubin as a role model for me. So yeah, either I picked up a lot of bad habits or picked up a lot of good ones, but congratulations to all 3, but especially to you, Brent. You're a rock star. And this was a great meeting, Rick. It was so well organized and so fast and useful, and congrats.
We will have it recorded. So again, you could pass it on to others, but if you wanted to memorize it, we'll have it recorded. Vince, you had a shout out.
Rick, you know, I was just trying to keep quiet so that I didn't.
Said shout out.
No, but just so I see Navneet is on the call. So just you know, he's been down in North Carolina as part of the FEMA response. So you know, the folks in this institute are also getting their hands dirty in the field doing the work. So thank you, Navneet.
Yeah, that's what I thought. I didn't know you were going to mention his work, but that's why I mentioned it up front, that we have to remember we're all connected, and we're enjoying great weather now, but global warming can bring that weather anywhere. It can bring it to North Carolina like that, inland.
I see Jeff.
Jeff Sturcio raised your hand.
Sure. Well, Rick, first, congratulations to you and all of your colleagues for the impressive amount of work that you've really gotten going at Rutgers in the Global Health Institute. You know, Rick and I have been talking about the idea for the Global Health Institute since even before he arrived at Rutgers, if I remember correctly. And it's just amazing to see how varied and impressive the work is that you've gotten started. The question
I didn't get it started. The people are already doing it. This is sort of bringing us all under one ship, but the pieces were built. And
Well, that's true. It's important. I remember from my days as an academic many decades ago that it's hard to herd this number of cats at a major university. So that's what's impressive about the fact that you're all moving in one direction now. What I wanted to ask though was one of the most interesting parts of your program is this partnership with Botswana, which you went right to the top, and President Masisi and the president of Rutgers uh, agreed that you had some pretty ambitious plans for that partnership. Give us, if you would, just an assessment of how you think things are going and what's next for that collaboration across the board.
Yeah, it's a mixed bag or mixed answer. To partner in multi-sectors, not just health, was the original partnership with President Masisi and President Barchi, and that's been harder to do. We already were there sort of on the ground in health, and we've been asked by the Ministry of Health to continue to work with the teaching hospital with to focus on cancer and to focus on primary care. So we work for the Ministry of Health in that respect, and like anybody should, if you're in somebody else's backyard, if you go to their dinner party, you don't tell somebody what to serve for dinner at their dinner party. So but I think it's harder to get going in multiple sectors. And with the economic downturn, things have been harder for both the US, as we know, and for Botswana. Botswana has diamonds, but with the artificial diamonds, very popular now in the West, maybe not in the East as much, but so it's hard to get some of the things going that, as Rick Garfunkel knows, he's worked there with BITRE, which is the Technology Institute, Science and Technology Institute. There are opportunities, I guess, but it's really any faculty or others that want to work there. People know that are here on the phone. I could list a lot of them. David Ferran, I did see, but Lori Goodell, Tina Mayer, Amelia Iwu, go on and on. You know, you go there and learn maybe how you can help and get involved in your sector. Maybe health is the easy one, Jeff, because we have a lot of strengths in that, but also a long-term partnership there because of HIV. But with leadership training, technology and IT, we've been trying in engineering and some of the other schools, and in student exchange is probably untapped. There's been some student exchange. We support PhD students at the School of Nursing and other places. Yeah, it's a matter of utilizing it. Rutgers does not have a lot of on the ground partnerships like Botswana. We hope there's a lot of activity in Ghana, as you've just heard about, and now Rutgers is opening an office in Ghana, so maybe that's an opportunity to be more on the ground there, because there's so many different partnerships and faculty working there. But Botswana, I think, is a mixed result so far, because there's so many possibilities, but it hasn't been able to work in all the different sectors of the original hope with the partnership as it started. But we're still very much partnered with the President's Office and the Ministry of Health and the University of Botswana. I don't know if that answers your question, but you know Botswana as well as I do. You're on the board of some organizations there and been going there as long as I have.
Well, and I think we're all holding our breath for the election at the end of October, and then things will clarify. Let's put it that way.
David Shear, I see his hand up. David is our first Impact Council member. I gave him no choice, but he had to join us. And I told him he had to leave Harvard and come join us. David, are you there? I don't see you. Your camera's off.
I apologize. I lost you. But Rick, congratulations on this really wonderful meeting today. I actually serve on a National Academy panel and I've gotten to know an individual who is from Ghana, and we had an informal chat about the parallel between Ghana and Botswana. And he basically said to me, just in the area of cancer, for example, there apparently is one mammography machine for the entire country. So clearly there's a lot of unmet need in that country. And do you see, for example, the fact that there seems to be stable government and some of the same sort of features that you've been able to take advantage of in Botswana, where you might actually make more progress in Ghana in terms of establishing that leadership in cancer treatment and cancer management for sub-Saharan Africa?
Yeah. We're not wed to doing cancer in Botswana. That's just because we already are there. But when we were asked to, but now we're looking at helping in Namibia, Lesotho, some of the nearby countries. And again, Ghana is a logical one for Rutgers because Rutgers Central is opening an office there. It'll be the representative office for Africa. That's really also going to be focused on student exchanges, getting a leadership position out there, having offices in Korea and in India and in Ghana. And so, but it seems that next a logical choice would be to partner more in Ghana, for sure, absolutely. And the needs are there, like most sub-Saharan African countries.
Thank you.